the Lake Charles Memorial Health System, obviously a large healthcare system in the Lake Charles area, suffered a data breach, and what is known is it's probably was what's called the Hive ransomware group probably sent a ransomware attack to the Lake Charles system, and they ended up releasing the information that they were able to exfiltrate or steal from the hospital system, and which usually points to the fact that there was a ransomware attack. They did not pay the ransom, so as penalty for not paying the ransom, they're releasing the data that they have found or exfiltrated in this attack.
Tony Sabi, head of engineering at Checkpoint Software, says cyber attacks on healthcare systems such as this will continue as they are popular targets for hackers.
Healthcare systems and hospital systems specifically are usually a very popular target for ransomware attacks and breaches of this nature. The Hive ransomware group that is purportedly behind this attack very often targets healthcare systems. The reason healthcare systems are targeted for a number of reasons is, one, they're more apt to pay a ransom. They're more apt to pay a ransom due to the fact that any outage of a clinical network can affect patient care. So we're talking about, life and death and medical needs being met. And also stealing data from medical systems. The data is worth a lot of money on the dark web.
Sabi has this advice for people who may be victims of data breaches like this.
If you're a victim or a proposed victim of this attack, what I would do is, monitor your credit, using any of the credit monitoring tools out there. Many times as part of breaches like this, they'll include, for a period of time, some free credit monitoring services that are provided. I would check your healthcare insurance records, make sure that there's no insurance fraud. We do see people getting healthcare information and using it for healthcare billing fraud, for getting prescriptions in somebody else's name, for obviously abuse of prescription drugs or illicit reselling of those prescription drugs. So I'd look at your health insurance information and make sure there's no sort of unauthorized charges, just like you would for a credit card.
Sabi said that the group behind this ransomware attack developed software for others to use to carry out breaches like this.
We're going to continue to see this type of attacks in the future. The group behind this, called Hive Ransomware, was an offshoot of what has been reported as a Russian hacking group that sort of disbanded but gathered back together under a new name. And this is what we call ransomware as a service. So they develop the tools and the techniques and the software, and they let some of their agents and partners go out and use their software to attack different organizations. And they provide the software and the payment information for their partners that are using their software to employ ransomware.
Joel Massey, ABC 31 News that works for you.